Well, thank you everybody for joining me. Sorry, I had popped off thinking I needed to jump off before I could jump back into this breakout room. So I'm Jill Hoover and going to talk to you tonight about physical therapy and how we do take care of cystic fibrosis patients, addressing exercise, but also so much more. Next slide. Thank you. I do not have any conflicts of interest to disclose this evening. So the objectives this evening are, my hope for you following this talk this evening is that you will understand the different ways that physical therapists can help individuals with cystic fibrosis in regards to breathing, posture, range of motion, bone health, mental health, and then of course, I have to talk about exercise. So I have been working as the primary cystic fibrosis PT at LeBonheur Children's Hospital in Memphis, part of the UT Health Science Center group for the last 7 years. I've been at LeBonheur for 11 and practicing for 13. COVID definitely changed the way that our center, you know, I completely stepped out at the beginning of this pandemic and then worked my way back into it. And instead of doing exercise endurance testing, we wanted to reduce the aerosolized particles. And I began doing a lot more education and just speaking with families about other ways that physical therapists can help their children and their almost adult children, because we do have them that are still in college. It's been really awesome being a part of this community. Next slide. Yes. So one of the first things that I assess when a patient walks in is just kind of their breathing pattern. Some individuals are upper chest breathers, some individuals kind of breathe in their mid chest, and then others kind of breathe in their abdomen, or, you know, people call that diaphragmatic breathing. We take measurements and can have an objective measure to see how well a patient's mobilizing, especially their rib cage, and that will allow us to kind of follow them throughout the visits and see if there's been a change and if there's things that, you know, need to be addressed. One of the first things I teach is pursed lip breathing. It allows an individual to get what I call the good oxygen in their lungs and the bad carbon dioxide out. So in order to keep oxygen saturations at a good level, I teach them to breathe in their nose and blow out their mouth. So for the kids, tell them to smell the flowers and blow out the birthday candles. So it's important just to keep their breathing controlled while they're doing exercise. And I have a little video that is a great little 45-second video to demonstrate this as well.
Pursed lip breathing is one of the easiest ways to help control shortness of breath when you are active. It slows the pace of breathing, making each breath more effective. With your mouth closed, breathe in slowly through your nose. Then breathe out slowly through your mouth with your lips in a whistling or kissing position. Here's how to do it. Remember to breathe out twice as long as you breathe in, and repeat this 2 or 3 times as necessary.
So great, easy, just video I found on YouTube that demonstrates it properly and kind of goes over the brief importance of pursed lip breathing for any individual that has shortness of breath. So can everybody see the PowerPoint? I lost it. Megan, can you see the PowerPoint?
It came down and
okay.
I'm trying to get it back up.
No worries, I was just making sure. The next thing I am going to talk about is just a really interesting article that I came across at LeBonheur. Some researchers did a project a few years ago where they looked at breathing and brain function, doing this special, it's called electrocardiography. yes, I'm butchering that, but they used that to assess how breathing was affecting brain function, and they found that slow, controlled breathing positively affected cognition. So I thought that was really interesting, since we all teach individuals about, with CF, and it's a important lung function to be able to breathe. So that's a really interesting article that I found, and its link is right there if y'all are interested in reading about it. The next thing that, we have to talk about when it comes to CF and physical therapy is posture is so important. It plays a key role in breathing, muscle length, as well as the rib cage mobility. So I've talked about that, and I'll talk about it again and go over how we can objectively measure that in just a few slides. So the next slide shows kind of some typical postures that not only individuals with cystic fibrosis struggle with, but also just the general population. Can you go to the next slide? There it is. So that first picture on the far left shows an individual with that kyphotic posture. The upper back is hunched over versus the right picture where you see the individual with upright posture. The second picture is kind of that forward rounded shoulder posture that individuals can get in if they're working at a desk too often, or, the next picture shows that forward head we get into if you're reading all the time or playing on your phone or looking at your phone, or your desk may not be at the appropriate height and you may be in that forward posture position. And then that last picture is slouch posture versus upright posture. And this is definitely something that students, as well as anybody working at a desk, kind of can suffer with. So we'll go to the next slide, and I'm going to have you practice. I can't see you all, but you can practice with me or I'll demonstrate. So sitting kyphotic, try to take a big deep breath in, blow out. Sit up tall with good upright posture, big deep breath in, blow out. So I'll have patients do this in the clinic just to demonstrate that when you are sitting upright and you are not slouched, you can get increased inhalation as well as exhalation for improved breathing and lung function. One of the tips I like to share with patients, if they're working a desk job or if they're in school a lot or even a car trip, take a towel roll and just place it along your spine. You have to be kind of in a firm chair. You can't be on a cushy couch or anything, but just that physical cue at your spine will help prevent you from going in that slouched position, because just feeling it right there makes you want to sit upright. So it's just a nice, just gentle cue to prevent that slouched and kyphotic posture. And standing, one easy way to assess your posture, or anybody that you're caring for's posture, is if they're standing and you notice that your thumbs, are facing in. A quick tip and cue is just to bring those thumbs facing forward. And that'll just kind of combat that forward rounded shoulder, bring you more upright to allow you to breathe better and just have improved posture, which can prevent pain from improper postures for too long. Next slide. So range of motion is very important. It includes rib cage mobility. Stretching is going to maintain lengthened muscles. Your shoulder, upper back are very important, which is going to directly help with breathing. And I'll talk about how keeping your muscles stretched and lengthened can help prevent pain as well as injury. So the way that I measure rib cage mobility, the objective measure is have a tape measure, just place it around the patient's chest. I use the bottom of their sternum as a point, and then have them take a big deep breath in, just have a loose hold on the tape measure and let it out. I'll have them do that 3 times. And just even that physical cue of the tape measure around their ribs kind of causes them to want to increase that. For my younger patients who kind of have a harder time understanding and coordinating that, I'll actually use that as a treatment method for their parents to actually give them that cue around their rib cage and tell them to like push against their hands to try to take a big deep breath in. And then their parents can actually give a cue to kind of get them to move more at that rib cage, especially if they're more upper chest or diaphragmatic breathers. So the next slide, I'm going to go over my 4 favorite stretches that I love to teach patients and that I do myself. So there's a corner stretch, the supine stretch with the roll along your spine, then you turn it sideways and do it across your spine. And then last, my favorite is the hamstring stretch. So the next picture shows the corner stretch. So the individual finds a corner in their home. One hand is on one wall. Next slide, please. And the other hand is on the opposite wall. Kind of make a W with your elbows, and you can 1 foot forward, or if you want to just lean forward, you're going to get a nice stretch on your front of your shoulders, your pectoralis muscles, which again, forward rounded shoulders, kyphotic posture gets tight. And so it's an easy stretch. You're doing both arms at the same time. Hold it about 30 seconds and do that about 3 repetitions to get some good lengthening of your muscles and increased range of motion. The next one, I showed you a minute ago, my rolled up towel. You want kind of a firm one, nothing soft or squishy. We'll even use like a pool noodle to just place along their spine. Arms are out to the side. Again, kind of opens the rib cage, opens of their shoulder for a nice stretch, combat some improper postures. And then the next picture depicts the towel roll horizontal across your spine. And the individual's arms are overhead. That really combats that kyphotic forward posture to increase mobility in, your back, your thoracic spine. And you can kind of just work the towel down every 30 to 60 seconds and just feel a great stretch and improved mobility in your ribs and your back. My favorite stretch, because it relates to so many people, is the hamstring stretch on the next slide. So your hamstring crosses 2 joints. It crosses your hip and your knee. You've got to pay attention to your knee position as well as back and position. So if you're unable to get on the floor, I'll teach this for a picture on the left where the individual is sitting up straight. She's stretching that right leg. Knee is straight. The toes are pulled back. The knee and toe are facing up. And then she, with very good posture, leans forward, maintaining that flat back. Sometimes it's difficult to do that. A lot of individuals will just want to kind of like reach for their foot, but really to get a true straight stretch on your hamstrings, you want to do that with as good a posture with a flat back as you can. The next picture shows the doorway stretch, which is one of my favorites. On the right, where the individual in the picture is very flexible. Most individuals will be further away from the wall, but you're stretching the leg on the wall, knees straight, toes pulled back. So if you're tight, you're going to scoot away from the wall to keep everything straight. Don't let the toes and leg kind of turn out. You want to keep both of the toes facing forward, pulled back, and feel a great stretch on the back of your leg. The nice thing about the doorway stretch when you're laying on the ground is you don't have to worry about your posture because the ground is doing that for you. So that's why I really like that stretch. Then I would be remiss if I didn't talk about core and back strengthening. This kind of goes hand in hand with stretching. So staying flexible, you have to, strengthen those muscles to your posture. So everything is related. So the top 4 strengthening exercises I cover with patients in general include in my home exercise program is the scapular retractions, prone Superman, bird dog, and then plank. So the first one, scapular retractions, you're wanting to just cue the individual or yourself to just bring your shoulders down and in. You will often see individuals immediately bring their shoulders up. So really cueing down and in. Some of my younger patients, I'll tell them to try to touch their elbows together behind them, and they'll feel a good strengthening of the muscles in their upper back. So that's on the next slide. So again, shoulders down and in, and then the next picture is two ways you can progress the Superman. So you're laying on your stomach, arms are extended overhead, legs are straight behind you, and then have the individual raise their arms and legs as they keep them straight. If individuals have a hard time with this, they kind of want to bend their arms, they want to bend their knees up. So really cueing on straight arms, straight legs. If they're not able to do it without bending them, I'll even start with just raising their arms and then just raising their legs, progress to when they can do both of those together. You want to control raising up slowly and lowering slowly. When you've gotten that down pat, can hold it for 10 seconds, 10 repetitions, I progress them to the second picture where they're doing the Superman, then doing a nice lat pull down, squeezing their shoulder blades together, squeezing those arms back, raising their arms back overhead, and then slowly lowering their arms to the beginning position. So that's a way to kind of progress it as individuals get stronger. And then next slide, the bird dog. So you make a table tap with your body. So you want your back flat, core is tight. Hands are underneath your shoulders, and then your knees are underneath your hips. And then kind of the midway to do this is to have the individual raise one arm and the opposite leg. So right arm and left leg while keeping their back flat, core tight, and not wobbling around. If you're unable to do that, you can break it down into single arm first and single leg. You can lower the arm or leg lower than you see the individual in this picture. If you can hold it, you don't have to raise your arm and leg that high, and then you alternate opposite arm and leg. Start, holding it for a few seconds and then switching sides, making it harder, holding it longer. So that's a really great core total, back, side, front, core exercise. And then the plank. Some people think, oh, I can't do the plank, I can't get on the floor. Well, I love the picture on the left. It shows an individual who is just leaning against a stable surface, elbows underneath shoulders, core is tight, back is flat, and holding that for starting at 10 seconds and then resting and progressing as you can. As you get stronger, you can lower that support surface, and then you can slowly transition to where the individual on the right is doing a forearm plank on the floor, core tight, back flat, glutes are squeezed, legs are squeezed, just to maintain that nice posture and really get good strengthening of all the muscles surrounding your lungs. Next, I'll have to talk about bone health. As a physical therapist, I of course do not do any bone imaging or testing of mineral density, but I do educate to try to find a way to motivate individuals to get active. So weight-bearing activities as well as resistance activities are going to help your bones get stronger. So swimming is an awesome total body strengthening activity. Cycling is another great activity, but it's really those weight-bearing activities where you're walking or jogging, jumping stairs, object, lifting weights, lifting your child. All of those are really great and will strengthen your bones to keep your bones healthy and prevent the osteoporosis and osteopenia that can sometimes plague individuals as they get older, as well as our cystic fibrosis population. So the mental health benefits of staying active and physical activity are so well researched and so important. You're going to increase the endorphins, which is going to help with mood, memory, sleep, anxiety, stress, even focus. So I try to touch, individuals and find individuals what is going to motivate them to active, and educating them how all around increasing their activity will help just overall well-being. So the mental health benefit of exercise cannot be ignored. And then, of course, I'm a physical therapist. I'm going to talk about exercise. So the goal is for 60 minutes of physical activity for children every day. So it kind of decreases to about 21 minutes a day as you become a young adult, which is about 150 minutes a week. Individuals do not have to do 60 minutes of physical activity straight, or even 21 minutes of physical activity straight, but you can break it up into shorter bursts, shorter bouts, and what you can fit into your day. You do want to do moderate intensity, so kind of difficult to carry on a conversation, but you're not huffing and puffing. This is also when I go back and really focus on that pursed lip breathing and make sure individuals aren't doing a lot of accessory breathing, aren't overexerting themselves, but doing that good pursed lip breathing with physical activity and exercise. And on the next slide, I'll show that there's so many different ways you can exercise. I focus on the fact that you do not have to go to a gym to exercise. You can exercise inside, you can exercise outside, walking, running, getting a jump rope, you can side shuffle across the floor. Sports, if, for younger kids, figuring out what's going to motivate them and what they enjoy to keep them active, and then maybe continuing that on to intramurals in college, and even, adult leagues to keep individuals motivated to stay physically active. Yoga is a great full body total strengthening, as well as range of motion increasing, flexibility, lifting weights. There are lots of online videos that you can find, and so many more. So I try to, run the gamut of options and talk to individuals about what it is that motivates them and what we can add to their life that they will enjoy, but that will get them active to keep them healthy. Some online resources, of course, cff.org is amazing. I love the patient stories that are on there that just totally touch my heart when I read them. It's on the next slide. And it's motivating. It's motivating. That I was reading one yesterday that was an adult who had started doing triathlons. He wanted to, get healthier, and then just loved it. And it really improved his lung function, his quality of life. And so cff.org is a great resource. The Everyday CF is another cystic fibrosis focused website on exercise and ways that individuals with cystic fibrosis can safely stay active and get healthier. And then a couple years ago at CF conference, the S Work It was an app that they were partnering with the cystic fibrosis community and allowing individuals with cystic fibrosis to download the app and have free access to all of the exercises on that app. So that was really cool. There's all kinds of exercises on there, from lifting weights to yoga to cardio, ways that you can just work out body weight. And so it's a really just awesome app out there. And there are so many more, even just videos on YouTube. And I have patients coming in the hospital and they tell me that, they found a great little app or a video on YouTube that motivated them and that they, continue to do to keep them active. I did not have a slide on this, but I did talk about this during my last talk. Prior to COVID, as a physical therapist, I did, educate and work with patients on huff cough. And then kind of with COVID, we were again trying to decrease the aerosolized particles. So I will just kind of go over it with individuals and then talk through that. So one of the big things that I find that patients aren't doing is doing airway clearance and huff cough during their airway clearance or during physical activity, which is a form of airway clearance. So cueing them to pause their vest every 10 or 15 minutes and stop and do 3 good huff coughs. I educate them that, you should be sitting up, you shouldn't be laying down. I've had some patients tell me that their, younger kids just sleep while they're on their vest. And I'm like, this has to be an active form of airway clearance. Everything is working together to, clear those lungs out. And so going over huff cough is definitely, one of the things that our respiratory therapists in our clinic work on, but also the physical therapists as well. So If anybody has any questions, my references are listed. Oh, Edie. Oh, great. That is awesome. Well, I'm so glad that you joined this breakout session. That is just so inspiring. I hope that you've learned something. If you have any questions, my information is on the next slide. Like I said, I am a pediatric physical therapist by trade, but I feel that all this information is applicable to individuals of, every age. So thanks for joining us tonight. That is really inspiring.
Yay, Jill, you did so well.
Oh, thanks.
This is a small group. There are only 7 of us in here. So if anybody has any questions, feel free to just you could unmute yourself and ask, or you're welcome to throw it in the chat.
I'm glad that I didn't go down during this.
Go down during this one. I'll tell you, we had some interesting issues happen this go around, but we really do. If nobody does, that does conclude kind of our education day. I think there are a couple other sessions that are still going if you wanted to hop